Listeners, welcome to another episode of Follow Your Path. My name is Meredith Herman, and I'm a current medical student at Michigan State University. And today we'll be talking to Dr. Laura Favazza. She is a pathologist at Henry Ford, Detroit, and she practices breast, head and neck, and molecular pathology. I'm also joined today by future pathologist, Dr. Casey Shuko. Welcome to the show, Dr. Favazza.
Thanks for having me.
No problem. So first off, I'm going to lead with a question to tell us about yourself and how you got into pathology, where you went to medical school, et cetera, et cetera.
Okay, so my name's Laura Favazza. Really it starts in undergrad. I went to Oakland University for undergrad, and it's in Michigan, and studied biochemistry. That's important for molecular. And then I went to Michigan State University College of Osteopathic Medicine for medical school. Medical school took me a little bit longer than most people. I took a year off between second and third year. Had some struggles with anxiety, so I took that year to get that under control and work through it, and really haven't slowed down since I've come back. So so that's kind of my background. I did my residency at Henry Ford Hospital, APCP, and then I went to Memorial Sloan Kettering Cancer Center for my Surg Path Oncologic Surgical Pathology Fellowship. I was also a chief fellow there. And then I did molecular genetics at University of Pittsburgh Medical Center, which was great. All of them were great. So now I'm back at Henry Ford in Detroit. I'm Michigan born and raised, so had to come back.
Wonderful.
Yeah, it's awesome to hear. Oh gosh, so both Meredith and I were also MSU folk over here. So go green,
go white,
go white.
All right, awesome. But you said biochemistry was I did biochemistry too, and I'm always kind of curious, especially with these little podcast interviews for the Follow Your Path. Was there a particular faculty mentor or a member or someone that really inspired you to pursue pathology as a career?
In medical school, no. I mean, maybe after I started doing, I think I did rotations in medical school. Fortunately, I guess as you guys are as we're rotating through the hospitals, I knew right away, no, not surgery. I kept getting sick in surgeries, not gonna do that. And then I was like, okay, internal medicine is kind of interesting. You get to think hard. I knew not OB-GYN. I knew not peds. I liked ER, but we didn't get to see it. You don't get to kind of follow up and get resolution as to what's actually the problem. I didn't like that. So I just kept saying, oh man, I don't like this. I don't like this. And not that I didn't like them, but I just couldn't see myself doing that for the rest of my life. And I kept thinking, well, I kind of liked our histo class, and it wasn't even path. That's not really path. It's just, we just looked at the screen, and I was like, oh, that's fun. And so I was like, well, maybe I'll try a path rotation. And, it's funny, I remember the moment I knew I was going to do it. I was rotating here at Henry Ford as a medical student. They can't get rid of me. And I was in the micro department, and I was learning about the Tigris machine, which literally, yes, I know. And I tell Dr. Tibbetts this, he's one of our microbiologists, it's literally the machine that diagnosed gonorrhea, chlamydia, STD testing. This is ridiculous that this is it. And he explained the technology to me, and I was like, oh my God, I did this stuff in undergrad. Oh my God, it's like actually useful. and I knew from that moment, this was what I was going to do.
That's
So.
really, yeah, that's really unique. I'm
Love
not,
that.
yeah, no, that's
Yeah.
phenomenal.
Yeah. Well, and every day I'd come home from the rotation and I'd be so excited to talk about, what cases I saw and it just felt right. And you get to really get a resolution. You have to think hard and you help people, but you don't have to meet them. And that was also very appealing to me because I get really sad.
Yeah, definitely. Well, that sounds like a really unique journey, especially coming from, an osteopathic side where, as we were talking, both allopathic and osteopathic programs have little less and less pathology exposure. Can you speak a little bit to some of the exposure you had or, how you went about getting additional pathology experience as a DO?
Yeah. So, I remember I started talking about it a little bit in my third year. My very first rotation, third year, was general surgery, which was just awful. I had no idea what was going on. And everybody was talking about what they wanted to do. And, I really thought I would do family because, osteopaths are huge in family medicine. So, and I said, I don't know, maybe I'll do path. And the surgeons were like the only ones who were very supportive of it. They were like, oh, we love our pathologist. You should totally do it. It was very surprising. Like, I don't know if it was surprising, but like that was their reaction. And then pretty much throughout the rest of the rotations, when I would mention it, it was kind of not so positive, right? So I think I scheduled a rotation because you don't get exposure. There's no exposure. So I scheduled a rotation just to see if I would like it. And I also called the medical examiner because I didn't want to do an ME rotation because we were very limited in the number of rotations we could do in PATH in the first place. At that time, you could only do 4 weeks. That was it. So I called the medical examiner and I said, hey, I'm a medical student. I think I want to do pathology, but I know we have to do autopsies. Can I come in and see one? Just see if I can handle it because, here's me passing out in surgeries. And they were like, yeah, sure, come on in. So that was really helpful because I could handle it after the first one. And then I was good. So, but it was, I kind of started to reach out to the pathologists at the hospitals that I was rotating at and just asking if I could come and look at their cases and see what they were doing. And they were really, really great in like letting me do that and kind of, yeah, I know. They were really, really great at letting me do that. And so that was kind of my way in, I think.
Wonderful.
Yeah, no, that's awesome to hear. I can definitely echo. I think the importance of doing actual pathology rotation. I'm in my transitional year right now, which for those who are listening and have no idea what a transitional year is, I'm basically like a glorified fourth year medical student all over again. Just a little more responsibility, a lot more inpatience, but nevertheless, still kind of like diving and putting my toes into a bunch of different waters and the sand and whatever the analogy you want to say. But my first rotation was pathology, and I was one-on-one with the chief pathologist here at my transitional year hospital. And I think just seeing the interactions that she had, with the surgeons, I think the amount of support that she had from other faculty, and then doing another rotation with a neighboring program earlier this past fall, just kind of seeing those same, I think, there's just wonderful, thoughts, vibes, whatever the term you want to use, towards pathologists. It definitely, I think, really echoed a lot to me. So I think kind of coming off of this, Dr. Favazza, is there any like advice or recommendations or for students who are, osteopaths or future osteopaths, man, what should they do to get pathology exposure in like, their first couple of years of med school? And what can we, is it rotations? Is there something else?
Yeah, I mean, it's tough. It's like, it's funny because there really was no exposure. I think, and back when I was doing this, oh my gosh, back when I was applying, the system wasn't together. So it was still the DOMD. So I was like, oh, I got to take the USMLE. So in the middle of my third year, I was taking the USMLE because I didn't know if anybody would take me, because there was nobody in the class before me that went to pathology, and maybe one person in the class before them, and I couldn't get a hold of them. So I really didn't have anybody to go to, right? Because there weren't anybody that went into it. But I think nowadays it's a little easier. Most places they don't care. I think, if you have, and you have people that, for me, I think rotating at a place that has a residency program was just key. You have to be at a place that has a residency program, because the labs at some of these smaller hospitals, they're great, and they're gonna show you what like a community pathologist does, but they're not gonna show you what you're going to be doing as a resident. So that, I think, is just key. You have to rotate at a residency program. You have to see what they do. And you can, when you're applying, if you're nervous, oh, do they take DOs? Do they take DOs? I would just go through each their websites. Oh, great, DOs. Okay, great. And then I'd have no problem applying there. But even if they haven't taken one, apply anyway. The worst they can say is no, and then or they'll take you, and then you'll prove that, hey, we're great, so just stop. And I remember when I was at MSKCC, their program director is a DO, and I just went up to her and I was like, it's so great to see that. You're amazing. Like, thank you. And it just meant a lot to see one in such an amazing place, in such a high position.
Definitely.
That's wonderful to hear.
Yeah, I think it's encouraging, to hear, over time that more and more DOs are applying to pathology. And Casey and I are, writing an article currently about these pathways to pathology, which it's under production now, and it's going to be published in Academic Pathology here in the future. But like you said, and we found in research is that, like having exposure is really important, and having role models as well is critical. People see people that they can be, in those positions. I think that is very encouraging. Casey.
Yeah.
Go ahead.
Oh, no, I was just agree. Yeah, totally agree.
Yeah, definitely. Were there any questions you had about the DO pathway into Casey?
Oh, no questions. Somebody came into the room, so we may. No worries about me over here. We're right in, take a little break in the action of the day to make sure we get this interview rolling. So
we have
to cut that part out.
I think things are even different from I can't believe I'm coming up on my 10-year mark of graduating medical school. It makes me feel so old. But even from then, things are very different. Path Twitter is huge, and I don't think that existed when I was a med student. Like, it just didn't. So you get exposed, like having that is really great. And then also, like, I know the people that I think there's been this perception that pathologists are all weirdos. And first of all, we all went to medical school, okay? Like, we must be like masochists or something to put ourselves through that, first of all. So like we all are, so get over that. But really, you know, the people I work with are so kind and so smart. And that's really what kind of drove me, was just being around such smart people, like every day. It's so I think that, you know, there's that perception as well. And then there's also a perception that most physicians really don't know what happens in pathology because they haven't, it's not a required rotation. So I think that's another issue. So if you're getting discouraged from people, because left and right, but you're good with patients, but you can talk to people. Well, you know, there's more, not, and it's great. We need people to take care of patients and do the surgeries and do these things. But, you know, you also, that's the great thing about medicine, is that you can kind of go any direction. But the great thing about Path is that you're still helping people, and you're, like I said, you're surrounded by smart people. And that was what really kind of, it's another thing that helped kind of drive me towards it.
Definitely. And talking about, you know, your path to, you know, pathology and finding your niche, can you talk a little bit about your path towards surgical pathology and then ultimately breast and head and neck and molecular pathology? Can you kind of share a bit more about that, process, how you got into that?
Sure. Well, I just like slides. They're pretty, you know, you get to look at art every day. It's pretty great. And, you know, it's, I don't know. I think I just kind of, when you start in search path, it's really hard. Like I just found, and you guys, maybe it'll be easier for you, Meredith, because you've had a little time, but that first year was so tough. It was like, I felt like I was gypped in med school, because all of these things all of a sudden existed that I never even like touched upon. And I was like, when did this become a thing? And so like that was really hard. Like your first year is very hard. But I think as I kept going, I just really liked Surge Path. I like grossing. I know and nobody likes grossing. I enjoy it. I like finding things. Like you're only as good as what gets put in your cassette. So my mentor here did breast, so I pretty much knew I was probably going to do that, because I just sat with him all the time, because he was so super smart. I wanted to learn everything I could from him. So every second I could, I sat with him. And so, you know, I really thought, okay, I'm just going to do Surge Path. And at that time in my residency, we didn't have next generation sequencing. It wasn't up yet. It kind of got up in my third year.
Mm.
And I was just going to do the one fellowship. I was like, okay, I got student loans to pay back. I need to get on with my life. I'm going to do one fellowship. And then I saw one case on NGS, and that was all it took. And I was like, dang it, I need to learn this. So
it sounds full circle. Like when you saw that, what was that called? That machine called?
The Tigress.
The Tigress. Yeah, it sounds like
which
all
is a great
along
name.
you really liked the machinery, and you know that, you know, it kind of came full circle for you.
Well, yeah, and you get to correlate the morphology with the molecular profiles, and and it's all, you know, in the end, it's more than just biochemistry, but it is biochemistry. So like, I really, really enjoyed my fellowship, and I really enjoy my time on molecular, because it changes super fast. So you always have to kind of read and keep up, and that was good. And then I didn't want to just do breast. I don't know. I guess I could have, but I just thought, yeah, maybe I'll get not bored, but like, I just want to do more. And another mentor here of mine, like I knew who my head and neck team was going to be. And I was like, yeah, that's it. I'll do head and neck because I get to be with them and learn from them. And they're super great and smart and patient. So, and head and neck's hard. It's still hard. It is so hard. Breast, I feel really pretty good about, but man, head and neck is a hard subspecialty. There's just a lot of stuff in a tiny area.
Yes,
No,
absolutely.
for sure. And you were talking about grossing, and and I think you said palpation, or maybe I was thinking you here to say palpation, but with
Oh my
and it
God,
made
yes.
me think. It was so, and made me think back to this
I
article that you
swear
were
to God,
part
I'm
of.
better. I swear I am better at it because of OMM. I
Yes,
swear. I swear.
absolutely.
You give me a neck dissection and I will find you 100 lymph nodes. Like,
And
Absolutely.
for really quick, before we dive into the next question, Casey, Dr. Favazza, can you explain what OMM is for the listeners who may not be as
oh,
familiar?
I
Osteopath, if
forget
to us
about
it is
that.
just common knowledge. Exactly. So can you share a little bit, in your words, what is OMM and what it stands for?
Yeah.
And, what?
So that's like it's like a additional class that we take in all through like first and second year of medical school at osteopathic medical schools. And it's osteopathic manipulative medicine, right? OMM. Yeah. And we kind of learn, I kind of akin it to physical therapy. We learn ways to like move people and stretch, feel for dysfunction and feel for abnormalities to kind of help people that have pain. If something's kind of not where it should be, we can correct it. And I mean, I'm a pathologist, but I still do it to this day. Like my husband won't let me forget because he really likes it and it makes him feel better. But you do a lot of palpation, And I even we had a student OMM clinic and I was a part of it. And so that got me even more exposure and it was very hands-on. So even when I was like, I told you I had anxiety, I was not the best student and I struggled, particularly in the first 2 years in medical school, but OMM was great for me because it was hands-on. I got to see stuff and do something with it, and you could feel and see the results. Yeah, but you had to palpate, and so I remember I would close my eyes and palpate, and every time I gross a case, you cut and I close my eye. I do this, close my eyes and feel.
That's
I,
awesome.
so this so there was this article that you helped write for the Pathologist back in 2021 called "One Destination, Many Paths," and I remember I was somehow looked through this article a while back, and this conversations bring this back full circle to me because in this article you say, and I quote, "The part of osteopathic medicine that helped me the most was learning how to palpate. It made me very good at feeling for grossing. Finding lymph nodes and tumors in tissue is easy when you're good at feeling differences in tissue textures." So for anyone listening, one destination, many paths, talking all about the DOs, path to pathology from different DOs at different stages of training. And Dr. Favazza was a part of that article. And I think palpation, gosh, it has so many utilities and so many different aspects of healthcare. And hey, pathology is one of them.
Yeah, I mean, if you guys don't mind, can I share like a case that I had when I was in residency? I wrote about this in my, this was my personal statement for my Surg Path fellowship. I will never forget this case. So it was a lung wedge. The patient had like a 1 centimeter lesion and they had done a frozen section on it, and it was just an infarction. So I got the case to gross. So I'm cutting, and I put my sections through, and then just before I put it down, I went back, closed my eyes, and felt. And I found a teeny tiny, like 1-2 millimeter nodule. And I cut it, and I was like, that's weird. It didn't look like a lymph node. It was like very white, but not like tumor white. It was very well circumscribed. But it wasn't like, like a cancer stellate thing. It was very well circumscribed. And I was like, that's really weird. So I was like, okay, well, I'll just put it through and we'll see what it is, which is like every day I got my slides. It was like so silly and so nerdy, but it was like Christmas. Yes, what would I see, And so I get the case and I look at it and I go, oh my God. I go to my attending and he's like, this patient owes you a car. You just saved their life. It was a small cell cancer. Well, you don't do surgeries on small cell carcinomas, right? Because we typically, at least maybe, I think now they're doing more, but most of the time, they're not getting resected because they have already metastasized. And this one even had lymph node, or not lymph node, you could see lymphatic invasion in this little tiny nodule. And I almost put that back in the bucket. But I was like, yeah, I'll just feel one more time. And it just was like kind of life-changing. Not life-changing, but I was like the first, because, kind of on the, it was path, you're kind of you're not on the front lines, you get the stuff, you make the diagnosis, but so that was probably what led her to her infarction, was because she had a tumor. And it was really awesome. It was a really awesome case. And I know.
Wow.
I'm lost for words right now. Oh my goodness.
Yeah, it was really it felt really good. I'm telling you, I almost put it back, but I just was like, I don't know if I did a good enough job feeling it yet.
Wow. Well, there you go. Your osteopathic training came in, when you least expected it. And, osteopaths can also belong in the laboratory and help diagnose cancer. And it goes beyond the myofascial release and beyond muscle energy techniques. So I think that's a really wonderful story.
And it will make you friends.
Yes.
Who have headaches.
Yeah,
I would work on people all the time.
Anyone out there who's in residency, with in a DO is when you're co-residents, just ask them if you have a headache or, back strain or whatever, just ask them to a little OMM. And I promise you will feel 10 times better after that.
Yeah, exactly. So that was I swear, I think it helped. I really think it helped me palpate. I really do.
Awesome.
Because it like forces you, even if you're not good at OMM, it forced you to concentrate on what your fingers are feeling.
Definitely.
Yeah, absolutely. No, man, that's a very powerful story. Very powerful. Thank you so much for sharing. I think we're running towards the end of our session here. I think we'll kind of leave the listeners, I think, with one final question. I think you shared so much about being a DO and getting involved in pathology. Do you just have any final remarks, or pieces of advice that the beginning medical students, being an osteopath and medical students, should really consider or think about? In regards to, getting into pathology as a field, the path to pathology, or just anything along those lines?
I think if you're interested, you would be surprised at how receptive people like pathologists are if you reach out to them. Like, yeah, you could come hang out with me. I think it was tough back when COVID was really bad and no one was allowed in the hospital. But now that things have kind of calmed down, I think, if you're really interested or not sure, just ask one. Because, if you ever watch, what is it, Dr. Glaucoma Flecken on, I think his pathologist things are very, very accurate, except I never named my microscope, but the pathologists will teach you. They will, we're not as antisocial as you think. And so if you're interested, reach out. And I don't think being a DO affects you at all in a negative way.
Awesome. Well, thank
At
you
all.
so much for sharing. It was a pleasure to have you on this podcast with us, and we look forward to sharing your story with all the listeners. So
Yeah.
that's it for today, for this episode, and thank you all of our listeners for tuning in. Dr. Favazza is on Twitter at Favazza Laura, if that's okay if I share your Twitter. And you can also, yeah, awesome. And you can also listen to our podcast on Podbean and Spotify, Amazon, the list goes on and on. So we look forward to our next episode, and stay tuned for more episodes.
Thank you guys so much.